You've probably heard people talk about diabetes your whole life. Someone's uncle has it, your friend's mom needs insulin. You see sugar-free labels everywhere. Ever wonder why there are two totally different types of diabetes and why mixing them up makes people so frustrated? Today, I'll explain type 1 versus type 2 diabetes like you're 5 years old. By the end, you'll understand why they're called the same thing despite having completely different causes, why the treatments look so different, and why confusing them creates myths that hurt millions of people. Let's start with what they have in common. Both involve blood sugar. Your body runs on glucose, which is basically sugar floating in your bloodstream. Every cell in your body needs it for energy. But here's the problem. Glucose can't just walk into your cells by itself. It needs a key. That key is called insulin. Insulin is a hormone made in your pancreas, and it unlocks your cells so glucose can get inside. When something breaks in this system, your blood sugar rises dangerously high. That's diabetes. Same end result, totally different reason why it happens. Type 1 diabetes is your immune system going rogue. Imagine your body has an army designed to fight infections and viruses. Normally, that army only attacks invaders, but in type 1 diabetes, the army gets confused and attacks your own pancreas. Specifically, it destroys the beta cells, which are the tiny factories that produce insulin. Once those cells are gone, they're gone forever. Your pancreas stops making insulin entirely. No insulin means glucose just piles up in your blood with nowhere to go. You didn't eat too much sugar. You didn't skip the gym. Your immune system just decided to destroy the wrong thing. Scientists still don't fully understand why this autoimmune attack happens. Some research points to genetic triggers combined with environmental factors, like certain viral infections. But the bottom line is this: nothing you did caused it. This usually happens in childhood or your teenage years, which is why it used to be called juvenile diabetes. But that name's outdated because adults can develop it too. In fact, roughly 40% of type 1 diagnoses occur after age 30. The point is, type 1 is autoimmune. It's not caused by lifestyle. You can't prevent it with diet or exercise. And you can't reverse it because the cells that make insulin are dead. That means people with type 1 need insulin injections every single day for the rest of their lives. Not because they're not trying hard enough, because their body literally cannot produce its own insulin anymore. Now here's where it gets totally different. Type 2 diabetes is not autoimmune. Your pancreas still works. It still makes insulin. Sometimes it even makes more insulin than normal. The problem is your cells stop listening to it. Imagine insulin knocking on the door of your cells, but the lock is jammed. The key still exists, but it doesn't open the door like it used to. This is called insulin resistance. Your body tries to compensate by making even more insulin, but eventually, the pancreas gets exhausted. Blood sugar rises because glucose can't get into your cells efficiently. Think of it like shouting louder and louder at someone who's wearing headphones. Eventually, your voice gives out. Type 2 develops slowly over years, sometimes decades. It's tied to genetics, aging, weight gain, inactivity, and how your body processes fat. It usually shows up in adults, though more teens are getting it now due to rising obesity rates. Unlike type 1, lifestyle plays a role. That doesn't mean it's your fault if you get it. Genetics load the gun, but things like poor diet, lack of exercise, and carrying extra weight around your belly can pull the trigger. Certain ethnic groups, including African Americans, Hispanics, Native Americans, and Asian Americans, face higher risk even at lower body weights. And here's the key difference. Because your pancreas still works, type 2 can often be managed or even reversed with changes that help your body use insulin better. Here's what makes this personally relevant. If you have family members with type 2, your own risk jumps significantly. Having one parent with type 2 gives you about a 40% chance of developing it yourself. 2 parents? That risk climbs to 70%. This means your daily choices about food and movement aren't just about fitting into genes. They're about protecting your future health against a genetic vulnerability you might be carrying right now. The treatments are completely different. Type 1 requires insulin from day 1. There's no other option. People with type 1 check their blood sugar constantly, calculate carbs in every meal, and adjust insulin doses multiple times a day. It's exhausting and never stops. Type 2, on the other hand, often starts with lifestyle changes. Losing weight, eating fewer processed carbs, moving more. If that's not enough, doctors add medications that help your cells respond to insulin better or help your pancreas make more. Some people with type 2 eventually need insulin too. but not because their pancreas is destroyed, just because it's gotten too tired to keep up. Here's what you need to understand. Type 2 can improve dramatically if you lose weight, exercise, and eat differently. Some people reverse it entirely, meaning their blood sugar goes back to normal without medication. Studies show that losing just 10 to 15% of body weight can put type 2 into remission. But type 1 cannot be reversed, ever, because you can't bring dead cells back to life. Someone with type 1 could run marathons and eat perfectly and still need insulin every single day. That's why it's so frustrating when people say things like, just eat less sugar, or have you tried exercise? To someone with type 1. It's like telling someone with a broken leg to just walk it off. Now check this out. Type 2 is far more common. About 90 to 95% of people with diabetes have type 2. Only 5 to 10% have type 1. But because type 1 requires constant management from childhood, it's often more visible. You see kids with insulin pumps, parents calculating carbs at birthday parties, teens checking blood sugar in class. That visibility makes people think diabetes always means insulin. But most people with diabetes don't start with insulin at all. Here's where the myths get dangerous. People assume type 2 is caused by laziness or eating too much junk food. That's not accurate. Some thin, active people develop type 2 because their genes made them vulnerable. Meanwhile, people assume type 1 could have been prevented with better habits. Also wrong. You cannot prevent an autoimmune attack. These misconceptions hurt people emotionally and make them feel judged for a disease they didn't choose. Worse, these myths prevent people from seeking help early because they feel ashamed. That delay can mean years of uncontrolled blood sugar silently damaging organs before treatment even starts. The symptoms overlap, which adds to the confusion. Both types cause extreme thirst, frequent urination, blurred vision, and fatigue. That's because high blood sugar affects your body the same way regardless of why it's high. But type 1 symptoms show up fast, sometimes over days or weeks. Type 2 creeps up slowly, so people can have it for years without knowing. That silent buildup damages your heart, kidneys, nerves, and eyes before you even realize something's wrong. By the time type 2 gets diagnosed, some people already have early complications from years of elevated blood sugar. Both types are serious. Untreated, both can lead to heart disease, kidney failure, nerve damage, blindness, and amputations. The long-term complications are nearly identical, but the day-to-day experience is different. Type 1 demands constant vigilance. Type 2 often feels manageable at first, but requires long-term discipline to avoid complications. Neither is easy. Neither is a moral failure. Both deserve respect and proper treatment. So to recap, type 1 is autoimmune. Your immune system destroys the cells that make insulin. It usually starts young and requires lifelong insulin because your body can't produce its own. Type 2 is insulin resistance. Your body makes insulin but stops using it well. It develops slowly and is tied to genetics and lifestyle. Type 2 can sometimes improve with weight loss and exercise. Type 1 cannot be reversed. Both are serious. Both cause high blood sugar and long-term complications. But the biology and treatments are completely different. So here's the real question. If type 1 and type 2 have such different causes and treatments, should we rename them entirely to stop the confusion? Or would splitting them up make people take type 2 less seriously as a life-threatening disease?